Hello and welcome to the channel. Today we are going to talk about an important mental health topic that affects millions of people around the world, yet is still widely misunderstood, and that topic is panic attacks. A panic attack can begin suddenly and create intense fear, a racing heartbeat, shortness of breath, dizziness, chest tightness, and a strong feeling that something terrible is about to happen. Many people experience these symptoms without understanding what is happening inside their body, which makes the experience even more frightening. This discussion is meant to create awareness and understanding, because when panic attacks are understood, fear begins to lose its power. A panic attack is a sudden surge of intense fear or discomfort that appears without real danger. It can happen anywhere, at home, at work, while traveling, or even during sleep. Panic attacks do not only happen to people who are weak, emotional, or unable to handle stress. They can happen to anyone, regardless of age, gender, or lifestyle. Many strong, confident, and successful people experience panic attacks, even though others may never know. To understand panic attacks, it is important to understand the body's natural survival system, known as the fight or flight response. This system exists to protect us from danger. When the brain senses a threat, it releases stress hormones that prepare the body to react quickly. The heart beats faster to pump blood, breathing increases to bring in more oxygen, and muscles tighten to prepare for action. This response is helpful in real danger, but during a panic attack, this system activates without any real threat. The brain sends a false alarm, and the body reacts as if it is in serious danger. Because of this false alarm, the body produces intense physical symptoms. The heart may feel like it is pounding or racing out of control. Breathing may become rapid or shallow, making a person feel like they are not getting enough air. The chest can feel tight or uncomfortable. The body may start sweating, shaking, or trembling. Dizziness or lightheadedness may occur, along with nausea or stomach discomfort. Some people feel numbness or tingling in their hands, face, or arms. Along with these physical sensations, there is often overwhelming fear and a sense of losing control. One of the most frightening thoughts during a panic attack is the belief that something is seriously wrong, such as having a heart attack, fainting, or dying. It is extremely important to understand that panic attacks are not dangerous. They do not cause heart attacks, brain damage, or death. Although the symptoms feel intense and overwhelming, they are temporary and harmless. The fear itself is what makes the experience feel so severe. Most panic attacks reach their peak within about 10 minutes and gradually reduce within 20 to 30 minutes. During the attack, time may feel slow, making it seem like the panic will never end. However, the body cannot stay in panic mode for long. Stress hormones naturally decrease, and the nervous system slowly returns to balance. Every panic attack passes, even though it may not feel that way in the moment. Panic attacks can be triggered by many factors. Long-term stress places constant pressure on the nervous system. Anxiety disorders can make the brain more sensitive to fear signals. Past emotional or physical trauma can increase vulnerability. Health anxiety can cause normal body sensations to be misinterpreted as danger. Lack of sleep weakens emotional regulation. Excess caffeine, energy drinks, smoking, or nicotine can overstimulate the nervous system. Hormonal changes and sudden life events can also play a role. In some cases, panic attacks occur without any clear trigger, which can make them feel unpredictable and frightening. When panic attacks begin to happen repeatedly and a person starts living in fear of the next attack, this is known as panic disorder. People with panic disorder often begin avoiding certain places or situations because they fear having another attack. Crowded areas, markets, public transport, traveling, or being alone may start to feel unsafe. This creates a cycle where fear of panic actually increases panic. The important thing to know is that panic disorder is treatable and manageable with the right approach. During a panic attack, the most important thing to remember is that the sensations are caused by panic and not by danger. The experience is uncomfortable, but it is not harmful. Slow, controlled breathing can help calm the nervous system. Breathing in gently through the nose and breathing out slowly through the mouth helps signal safety to the brain. Bringing attention to the present moment can also help reduce fear. Noticing the surroundings, Physical sensations and sounds help shift focus away from panic. Trying to fight panic often makes it stronger, while allowing the feeling and reminding oneself that it will pass helps the symptoms fade more quickly. Long-term management of panic attacks focuses on calming and supporting the nervous system. Maintaining regular sleep helps stabilize emotions. Reducing caffeine and nicotine lowers overstimulation. Gentle physical activity helps release stress. Relaxation techniques such as breathing exercises and mindfulness calm the body. Psychological therapy can help change fear-based thinking patterns. In some cases, medical treatment recommended by professionals can be very effective. Seeking help is not a sign of weakness. It is a responsible and healthy step. Support from others plays an important role. People experiencing panic attacks need understanding, patience, and reassurance. Calm words, presence, and validation help reduce fear. Dismissing or minimizing the experience can increase distress. Compassion and support make recovery easier. Experiencing panic attacks does not mean a person is weak, broken, or unstable. It means the nervous system is under stress. With awareness, proper care, and support, people recover and go on to live healthy, fulfilling lives. Panic attacks are intense, but they are temporary. They are frightening, but they are manageable. They do not define who a person is. Understanding panic attacks is the first step toward reducing fear and regaining control. If panic symptoms are frequent or disruptive, professional support can make a meaningful difference. Thank you for taking the time to understand this important topic.